My name's Dr. Michael James Muehlberger. I was born in Arlington, Virginia. Grew up there until I was about 6 years old. My dad was transferred to Memphis, Tennessee, and that's where I spent the majority of my childhood, as well as adolescent years. I have two younger brothers, one younger sister, all of which have gone on to college and graduated from college. In high school, I was pretty involved in athletics, including baseball and basketball, playing both sports year-round. I played a lot of competitive summer baseball as well as AAU basketball and developed a love for both sports. I went on to pursue my academic career at Austin Peay State University, where I also played varsity basketball for 2 years. From over the next 2 years in college, I devoted most of my time to my academic studies in my attempts to get into medical school. After I graduated summa cum laude from Austin Peay State University, I went on to take some time off and had several odd jobs, one of which was working at the Elvis Presley Memorial Trauma Center in Memphis, Tennessee. There I was an orderly for 2.5 years. I also taught 11th grade English for a year at my former high school, which was a great experience as well. Once I finally got into medical school at the University of Tennessee in Memphis, I continued to work at the trauma center, worked as a suture tech and helped in any capacity that was needed from me. I went on to gain a strong interest in surgery, trauma surgery. Thought I wanted to be a trauma surgeon initially, however, did experience a lot of vascular trauma at that trauma center, and from there I developed an interest in vascular surgery. From the University of Tennessee, I did my general surgery residency in Jacksonville, Florida, at the University of Florida at Jacksonville. Roughly around my second year, I developed a strong interest in vascular surgery and kind of knew that was the direction that I wanted to take. I had some great mentors there in Jacksonville, and after graduating from the University of Florida in my general surgery residency, I went on to pursue my vascular surgical fellowship in the University of Virginia, where I gained great training from my mentor, Dr. Cherry. I was lucky enough to meet the guys here at the vascular specialists of Central Florida prior to my leaving the University of Florida. Gained a relationship and came down here soon after my training at the University of Virginia. And from there I've enjoyed my time here in Orlando and hope to spend the rest of my life here in Central Florida practicing vascular surgery. Many people may ask why I chose vascular surgery as a specialty. I simply tell them that I think it involves all aspects of being a surgeon. Number one, I think you have a great relationship with your patients. You see them from day one and usually until the end of their life, because our care basically spans a whole lifetime for them. And it makes it nice to really understand and get to know the patient throughout their time here. I also think that it also gives the surgeon the ability to not only treat the disease from a medicinal side, but also from a surgical side. And the things that vascular surgery offers nowadays is a lot different from what they were able to offer roughly 10 years ago. We're trained in endovascular technique as well as open surgical technique, and I think what we have to offer certain patients goes far and beyond what other specialties may offer. What sets me apart from maybe others that practice medicine is the fact that I put the patient first. I do understand that not all patients are the same. They can't be treated just as the books may outline, but every patient deserves to be treated differently. And from that standpoint, I think they gain a trust in me as a physician, knowing that I'll do the right thing for them, that I always listen to them, that I take into account every aspect of their life and their multiple comorbidities, because most of my patients are very sick. And I'm in it to basically make the patient have a better quality of life. And I think if you spend time with the patient and their families, they appreciate that. When I was in college, I injured my knee. Had to be on the other side of the table as a patient. I got to see what it was like to go through rehabilitation, the whole process from start to finish. It was a very difficult process, and I had to rely on the trust of my physician as well as the team that was surrounding him and the treatment plan for me. I thought that I gained a lot of insight into that patient-care relationship and wanted to be on the other side. I thought I had a lot to bring to the table as a physician, and developed more knowledge throughout my years in working in the trauma center in Memphis, Tennessee, as well as some of the local clinics around town, kind of getting a better feel of what it was like to be a patient care provider, not only following surgeons, but also family practice doctors, internal medicine doctors, all of which allowed me to gain insight into that whole patient-doctor relationship.